Hi, my name is Reese, and so you're here for a swallowing evaluation today, right?
Yes.
Perfect. So, today we're going to do 3 different ones. We're going to do an oral Mech exam. So, we're just going to look at your cheeks, your tongue, everything going on in your mouth just to make sure everything's in the right place and everything moves correctly. Then we're going to do a cranial nerve examination. So here we just want to make sure, if your brain is telling your body to do something, that it's actually happening the right way. Then lastly, we're going to assess your swallowing. So I'm going to give you different liquids in moderation and different food consistencies to try, and we just want to make sure that your swallowing reflex is correct.
Sounds good.
So to you, if you have one, what would you think a swallowing problem is?
Not being able to swallow, like nothing's going down.
Okay. So, like I said, first we're going to start with our oral Mech exam. So, is it okay if I touch you during these examinations?
Totally fine.
Okay, so then I'm just going to sanitize my hands and put some gloves on, and then we'll get started. So, for the very first one, I want you to just look straight face at me. Perfect. Okay. Now, can you open and close your mouth?
Mm-hmm.
Perfect. Okay, and can you do that one more time, please? Perfect. Okay, now I'm just going to use a depressor, and I'm going to look at the inside of your mouth. So I want you to stick your tongue up and out, and then just out in general. I want to get a good look at your teeth. Great job. Now can you stick your tongue out? Great. Now can you just smile for me? Perfect. Now can you pucker your lips? Great. Now what I want you to do is pucker your lips and press your tongue against them. Now can you smile one more time? Perfect. Now I want you to puff your cheeks and hold in the air. Okay, now release. Okay, now I'm going to get a good look at your tongue. So can you just stick your tongue out for me? Great job. Okay, now I want you to retract your tongue, so just stick it out and then put it back in. Great job. Now can you move your tongue tip to the right? Great job. Now can you move your tongue tip to the left? Great job. Now I want you to move your tongue tip up and tongue tip down. Perfect. Now can you move your tongue in rapid side-to-side motions? Perfect. Okay, now I'm going to take a look at your pharynx. So again, I just want you to kind of keep your head just straight towards me and open your mouth. Perfect. Tip your head a little back. Perfect. Now, I'm going to evaluate your hard and soft palate. So same thing, I'm going to put the depressor in your mouth once again, and I'm just going to look at the roof of your mouth. Great job. Now, the last one we're going to do is, for this section, I'm going to assess your gag reflex. So if you gag, that's okay. Great job. Okay. Now, I'm going to ask you to hold an ah sound and stick your tongue out. Now I'm going to take a look inside. Perfect. Okay, so now we're going to move on to our cranial nerve assessment. So the first thing I want you to do is I want you to clench your teeth. Now I want you to do like a clench and release motion. Like if I'm putting, good job. Now open and close your mouth. One more time. Thank you. Now, with your mouth open, can you move your jaw from side to side? Perfect. Now, can you show me a chewing motion? Great. Now, I'm going to use a Q-tip, and I'm going to stroke a section of your face or your mouth, and I want you to tell me where I'm touching.
All right. Left cheek, right cheek, mouth, chin.
Great job. Okay, so now again, look straight at me and just rest your face. Perfect. Now can you wrinkle your forehead? Great job. Now close your eyes. Close your lips. Perfect. Can you pucker your lips? You can open your eyes now. Can you smile? Now puff your cheeks with air. Great job. Now say pa. Great. Now, toward the front of your tongue, I'm gonna present 2 different tastes to you, and I want you to just let me know what it is. So it can be anything from salty, sour, sweet, bitter. I just want you to let me know.
All right.
So stick your tongue out.
Salty.
Okay, one more.
Kind of sweet.
Okay, great job. Now, I'm going to take another look inside, and I want you to say, ah, once again. Great job. Okay, now the same thing. I'm going to present 2 different tastes to you, but this time on the back portion of your tongue. So just stick your tongue out for me. Okay.
Salty still?
Mm-hmm. Great job.
Sweet.
Great job. Now I'm going to assess your gag reflex one more time. So I'm going to use my finger and a depressor this time. Great job. Okay. Now this time I want you to say ah and hold it. Great job. Now can you cough? Great job. Now can you repeat a sentence to me?
I like apples.
Great job. Can you do that one more time, please?
I can actually. So sorry. I like apples.
Now, can you just swallow for me really quick? Great. One more time. Perfect. Okay, now I'm going to ask you to turn your head side to side. Perfect. Now I'm going to add some resistance, and I want you to do the same thing. Perfect. Now I want you to shrug your shoulders up and down. Great. Now I'm going to add some resistance. Do the same thing. Perfect. Okay. Now I want you to stick your tongue out and pull it back in. Perfect. Now I want you to lift your tongue up to try and touch your soft palate. Great job. Now I'm going to put some resistance on your cheek. I want you to push against it with your tongue. Perfect. Now I'm going to place a tongue depressor on your tongue, and I'm going to try putting it on the tip and on the sides, and I just want you to push against it. Great job. Great job. Great job. Okay. Now we're going to move on to our swallowing assessment. So you're sitting upright, which is perfect. I'm going to give you a few things to eat and a few things to drink, and so just let me know when you're ready.
Ready.
Perfect. So the first thing I'm going to assess is just a dry swallow. Perfect. Okay. Now I'm going to give you 1 teaspoon of water. So I'm going to give you a cup of water. So here's this. And I'm going to give you a spoon, and I just want you to take a teaspoon and swallow that for me whenever you're ready. Perfect. I'll take this back. Now I want you to take a typical size sip from the cup. Perfect. Now I'm going to ask you to pour a little bit more in for you, and ask you to take one larger sip from the cup.
Alright.
Just give me 1 second. Okay, go ahead. Great. Now I want you to take 2 sips in a row as if you're really, really thirsty. Great. Now I'm going to give you a straw, and I wanted you to take 2 sips back to back from one another. Great job. Okay, so now we're going to move on to our different foods. So the first thing I'm going to have you try is a teaspoon of applesauce.
Alright, sounds good.
So just like a spoon, a little bit more. Great. Okay, and can you open up your mouth for me? Lift your tongue up.
Out.
Perfect. Okay, and I'm just making sure that I'm trying to see if there's any food left in the mouth. Okay, so now I'm going to give you some of a fruit cup or a fruit cocktail. Again, I just want you to take a teaspoon, and you can chew it. You don't have to swallow it directly.
Alright.
Go ahead and grab a teaspoon and just give me 1 second. Okay, go ahead. Perfect. Okay, and the last thing is I'm going to give you a cracker, and I just want you to take 1 bite. Perfect. Okay, now I'm going to give you some water so you can rinse that down. Can you open your mouth really quick before you drink for me? And tongue up. Perfect. Okay, so then that's all for today. We finished all our exams. Do you have any questions?
Nope.
Perfect.